Hi, everyone. This is Sean with the Mass Support Network. Today, we're going to answer some common questions about the topic on everyone's mind, the Delta variant. First up, how is Delta different? Delta is one of 4 variants of concern identified by the World Health Organization. A variant is basically a mutant strain of the coronavirus. It's mutated slightly, enough to behave a little bit differently, but not so much that it's a different virus altogether. When these are discovered, they are given a scientific identification number, such as B.1.617.2. But as this turned out to be a bit confusing, the World Health Organization has started labeling the most prevalent of these with Greek letters. You may remember alpha, previously known as B.1.1.7, as the more transmissible variant spreading in Great Britain. There was a lot of concern that that was going to take off and become the dominant strain of the coronavirus. However, it turns out Delta came for the throne and took it. Back in May, the Delta variant accounted for barely 1% of all coronavirus cases in the United States. At the beginning of June, it was nearly 10% of all cases. In early July, it was more than 50%, and by the end of that month, these past couple of weeks, it's over 80% of all cases in the United States, squeezing out alpha and other strains like an invasive species. This is what accounts for the exponential rise in cases we've been seeing around the country and here in Massachusetts, as we've reached heights unseen since April, undoing all the progress we've made and wiping out those lows we saw in June. Or in fact, higher than we were at that point in late March and early April. We were afraid we might be about to head into a new wave. Now, with these case counts rising, of course, the question that follows naturally is Delta more deadly than other variants? Answer to that is possibly. First of all, it may be slightly more dangerous than other variants, but any disease that's more infectious, that reaches more people, is going to cause more deaths just based on the numbers game. Also, many of the most vulnerable people have already been vaccinated, which means that people who might have died aren't going to because of the vaccine. So on the whole, it's hard to tell if Delta is more deadly than the standard COVID strain. We can say that on paper it might be, but in the real world, it's hard to tell. Of course, that naturally follows to, does the vaccine still work against Delta? And the answer to that is yes, with an asterisk. So the Moderna and Pfizer vaccines are still highly effective at preventing severe infection. Johnson & Johnson, a little less so. But single shots of mRNA vaccines are significantly less effective. If you only got one shot, and we're hoping that would be enough, it's not going to be. Go back and get your second dose. And breakthrough infections, which is when a vaccinated person comes down with coronavirus symptoms anyway, those are going to be a lot more likely. Also, vaccinated people appear to be able to infect others, which we thought was hopefully not possible earlier in the year. And with the standard variant, or the previously standard variant of coronavirus, that wasn't the case. However, recent outbreaks, particularly the one on Provincetown in Cape Cod, have showed that it does appear to be possible for vaccinated people to both become sick and pass it on to other people. However, that said, the vast majority of Delta cases are still in unvaccinated people. There are eye-catching headlines like the Provincetown outbreak. However, the 100,000 cases we saw today, most of those people had not received a vaccine. And also, effectively, all hospitalizations and deaths from the Delta variant are still in unvaccinated people. So the main difference here is previously we hoped that the vaccines would halt transmission of the virus and we could use them to protect each other. The bottom line, though, is getting your vaccine will protect you, making a serious illness or death almost completely unlikely. You may still get a little bit sick. It's not going to be as bad as if you were not vaccinated. Do I need to start wearing a mask again? Well, short answer, yes. Long answer comes down to the guidelines from the state and the CDC. Now that we know that it is possible for a vaccinated person to pass on the virus, we are going to change our thinking a little bit at the moment. The state is encouraging masks for anyone who has health conditions or vulnerable family members, such as children under the age of 12 who are ineligible for vaccines. Basically, this way of thinking is changing from whether you need to wear a mask because of the situation in your area versus what you're trying to protect. And if there's a risk that you could pass the virus on to someone in your immediate family who is unable to be vaccinated or has something like a weakened immune system, which of course means that the vaccine may not have been as effective for them, you should definitely wear a mask. Same is also true, of course, if you yourself have health conditions or a weakened immune system that puts you more at risk for a serious case, it's best to mask up. Also, of course, in Massachusetts, masks are still required in healthcare settings and on public transit. The CDC, meanwhile, has put out guidelines suggesting that people should wear masks based on the transmission level in your area. If you're in a place that has substantial or high transmission, which is considered 50 or more cases per 100,000 people over the last week, you should be wearing a mask anytime you're indoors in a public setting. So anytime you're indoors that isn't your own home, you should be wearing a mask. Now, when we look across the state, almost the entire state is in this substantial or higher band. Just the northern Connecticut River Valley is still in the moderate level. And of course, Barnstable County is high following the Provincetown outbreak. This means that by CDC standards, most of the state should be wearing masks when indoors and in public. The country as a whole is almost entirely above that threshold. Aside from some rural pockets in that central corridor there and parts of the Northeast, almost every part of the country is in substantial or higher. You can see almost the entire South is that deep red, indicating there is high transmission there. Will we need booster shots for the Delta variant? It's unlikely for a couple of reasons. First of all, 2 shots of the mRNA vaccines appear to be plenty for now. Perhaps slightly less effective, but again, the vaccines we got were better than the ones we were expecting, so they're still good enough for now. However, there are shots geared towards Delta and other variants in the works now, and in a few months, we may be reevaluating that as something more specialized comes along, besides getting simply a 3rd shot of the vaccines we've already been taking. It's also worth noting that the World Health Organization has asked that countries such as the United States not pursue booster shots while so much of the world is still lacking for their first shots. They need their first dose more than we need our 3rd doses. If we really want to get this thing licked, we need to stop it all around the world, not just in America. Will there be more variants? Well, sort of. There are, of course, going to be more mutations of the coronavirus. Viruses change over time as they meet new immune systems and travel around the world. And there are other variants under observations. However, any variant that would rise to the level of variant of concern is going to have to compete with Delta, which is already the 800-pound gorilla in the room. Also, there's only so much a virus can mutate before it stops being able to effectively infect people. It can change in a way that could completely evade our immune system, but in the process lose its ability to enter our cells, and then it's simply not a virus that affects humans anymore. Also, there's only 24 letters in the Greek alphabet, so logically, we can only see 20 more of these things. For more from the Mass Support Network, you can find us on our website or on social media. And remember, wear your mask, get your shot, and we'll be here if you need us. Stay safe.